Welcome everyone, good morning, and thank you for joining us today. I'm Nicole Dupuy, Chief Executive Officer of the Windsor-Essex County Health Unit. Today we are reporting an increase of 70 new cases of COVID-19 in Windsor and Essex County. 5 are close contacts of a confirmed case, 3 are community acquired, and 62 are still being investigated. We have had 17,904 cases since the beginning of the pandemic. 472 people are active at this time with COVID-19. To date, 2,741 preliminary or confirmed variants have been identified in Windsor-Essex. 738 of those are Delta. 15 people are currently in hospital and 5 people are in the ICU. Unfortunately, we reported an additional death due to COVID this week. A woman in her 50s passed away. I'd like to share our condolences to her family and loved ones. We have lost a total of 439 people to COVID-19 in our community. There are currently 10 outbreaks, 9 workplace, 1 community. We've also issued a number of notices for public exposures on our website. For our vaccine update, 298,795 people in total have received at least 1 dose of COVID-19 vaccine. Overall, 78.7% of eligible residents 12 years of age and older in Windsor-Essex have received at least 1 dose, and 71.6% of eligible residents 12 years of age and older are fully vaccinated. Since the beginning of the pandemic, staff at the Windsor-Essex County Health Unit have worked tirelessly in their professional and personal lives to keep our community and those close to them safe. Our team of public health professionals have given their nights, their weekends, and frankly their lives for more than a year to ensure critical public health services are maintained and implemented in the face of a global pandemic. We have walked the talk in terms of adherence to public health measures, staying home when sick, adapting to work from home requirements, wearing masks in the workplace, washing our hands often, and maintaining physical distancing. I'm proud to announce today that our team at the Health Unit will be joining other community leaders and health services like our municipalities, hospital, and post-secondary institutions by implementing our own vaccination policy for our staff. The decision to institute this policy was an easy one for us in public health. As we find ourselves in the 4th wave of the pandemic, maintaining the health and safety of our workforce is critical to ensure that we can continue to provide essential public health services for our community. Even more important is maintaining the health and well-being of our vulnerable clients and ensuring that we are protected from bringing this virus home to our families and contributing to spread. The WECHU encourages all employers and workplaces to consider a vaccination policy to protect the health and safety of their workers and the community that they serve. This includes for public settings, including in that policy a vaccination verification process for patrons and residents of patrons of non-essential services. Whether you're in manufacturing, retail, hospitality, agriculture, or public sector, instituting a vaccination policy for your staff is the best way to protect your workforce from COVID-19 and ensure the ongoing operations of your business. For those workplaces interested in learning more about vaccine policies, there's a list of frequently asked questions on our website at wechu.org, wechu.org/cv/workplaces. You can also email our vaccine@wechu.org to request a mobile vaccination clinic for a mobile team to administer first and second doses of the COVID-19 vaccine on site at your workplace. WECHU will assist in the planning and promotion of the clinic and help answer employee questions about the COVID-19 vaccine. An additional important item that I would like to discuss today is the importance, of course, of being fully vaccinated in order to protect yourself from COVID-19, in particular with Delta. While it is true a single dose offers some protection, this can diminish over time, and in our community there are approximately 18,000 people who are currently eligible to receive a second dose who have not yet received it. This is why we've partnered with the Provincial Ministry of Health and the Office of the Chief Medical Officer of Health, Dr. Karen Moore, to reach out to all Windsor-Essex residents who are eligible by phone with a recorded message from Dr. Moore, encouraging them to book their second dose or move up their appointment as soon as possible. In addition, the WECHU will be contacting all eligible residents by email and has worked with our partners in local vaccine booking center to conduct live outreach phone calls to eligible residents. Those who are eligible should expect to receive a phone call beginning this evening, and as always, can book their second dose at wevax.ca or can walk in to our mass vaccination site at Devonshire Mall. I'd also like to thank the City of Windsor and the County of Essex for launching the WeVax to Win lottery. This is a wonderful initiative to encourage and reward our community members for stepping up and completing their full series of COVID-19 vaccination. Again, to book your vaccination, go to wevax.ca or walk into a pharmacy, talk to your healthcare provider, or walk into our mass vaccination site. If you have questions related to the safety or effectiveness of the vaccine, talk to your healthcare provider or contact the health unit for more information. Lastly, I want to say thank you to Madeline Macbeth, who made me this lovely homemade bracelet that says COVID sucks. And I just want to say to Madeline, I couldn't agree with you more, and I think most of us in the health unit would agree. It certainly does. So thank you very much. I'll wear it every day and wear it proudly. I'll now turn it over to Dr. Ahmed for our weekly Epi Summary. Thank you.
Good morning, and thank you for joining us. Today I'll take a different spin to our usual Epi Summary. I will only share key statistics and discuss them more for a better understanding of what is going on in Windsor-Essex right now. We will post the full slide deck with all the data elements on our website after our presentation. I want to start off today by giving a very clear message to the community. We are experiencing a fourth wave in our community. The cases are increasing at a rapid rate, and this particular wave could be worse than any other wave we have seen before. You may wonder why I am saying that this wave could be worse, specifically when we have a high percentage of vaccinated people. So let's take a look at what's happening around the world. So as we can see, almost every country is going through a fourth wave. Some are plateauing, some are still on the rise, including our neighbor US, which has seen a significant increased number of cases in this particular wave compared to even the third wave that we recently finished. We are starting to see cases increasing in Canada. We are starting to see cases increasing in other parts of the world as well, even in the countries such as Japan, which has seen which had one of the best response as well in terms of containing the disease. Similarly, when we are looking at what's happening at the hospitalization, so even though it's a lagging indicator, but we are seeing that the hospitalization are on the rise as well. Not to the same extent as we have seen before, but it is on the rise. Likewise, the ICU admission we are seeing is increasing in Canada, Spain, US, and France. And if we'll just focus on the US, we can see that the ICU utilization is probably one of the worst that we have seen so far in compared to other countries, which is a great signal to warn us that what can come if we continue to lag behind our vaccination and not fully vaccinate. So what can we conclude based on what is happening around the world based on these three slides? So number one, cases are increasing worldwide, which is triggering a fourth wave everywhere. And number two, the high case rates and the corresponding impact on hospitalization and ICU is not the same as previous waves and is highly dependent on mainly two factors. One is the vaccination rate and the other one is COVID-19 restrictions. If you have a higher vaccination rate, you are seeing less of an impact. If you have more COVID-19 restrictions, you will see less of an impact. And if you take away both those, you will see a more significant impact both on hospitalization, ICU, and people dying. So what kind of impact are we can anticipate in our community given that we have entered fourth wave? And I will quickly go through the significant activities and significant timelines in our community to further elaborate on the impact. So very quickly, we had our first case in March 20th, 2020, when we first notified of the case. Then continuing on along the year, we have seen the pandemic response. We have seen May 19th emergency order was amended to start reopening, and then we saw again that December 26th we went again into a province-wide shutdown, and now starting from June 11th we started to enter at step 1, and right now we are in step 3, which is pretty much the same as everything is currently open with all the activities that we can do right now. So now coming back to the summary, what are our challenges? So vaccination rates are plateauing. We're seeing that 78.7% of all eligible population in Windsor-Essex have received at least one dose. 71.6% of all eligible population are fully vaccinated. Number two, large number of people that still are unvaccinated, so which is at least 20% of the eligible population, which roughly equates to 60 to 70,000 of people who are 12 years and older that are unvaccinated. And then you have 12 years and under who are not yet eligible to receive the vaccine, and that also includes roughly around 50 to 60,000 people. So in total, we're talking about at least 100,000 to 120,000 people in Windsor-Essex that are currently either not eligible to receive the vaccine or unvaccinated or partially vaccinated. Since we have entered step 3, that means pretty much everything is open that is essential, and as well as those businesses and those activities that are non-essential, everything is open, including nightclubs, bars, restaurants, malls, workplaces, everything is open. Social gatherings are allowed in private setting as well as in public setting. Schools will be reopening soon. All of those measures will continue to bring more people together and continue to increase the risk. So what truly worked in the past was COVID-19 restriction to limit the potential exposure and reduce the transmission. These measures helped us to break the chain of transmission and contain the COVID-19 spread. So very quickly, I won't spend too much of time in it because I already have shared this particular slide before. But basically, what it does every time when we're talking about the chain of transmission is adding additional layers of protection to break the chain at every possible steps in our community. And of course, the main goal of any kind of infectious disease is to eradicate the virus or the source of bacteria, but we couldn't achieve this goal. We continue to work in containing the disease by early identification and isolation of the infected individual, by slowing the spread, bending the curve to allow us to develop the vaccine, find a cure, and above all, save lives. We actually did pretty well in that area. We started off with the projection back in March 2020 that with no control measures, we will see up to 4,000 deaths in our region. We talked about preparing temporary morgues to ensure that the health system is ready to deal with thousands of people dying, many hospitalization, and many unable to access healthcare due to capacity issues. We then spent a lot of time in educating the public about COVID-19, dispel any myths, and correct any misinformation. As we continue to counter many of these misinformations, people who don't believe in COVID continues to bring in more and more misinformation, creating doubts in everyone's mind. As of today, our region has lost 439 people with COVID-19 diagnosis. That is roughly 90% of the lives that we have saved from where we started as the projection. So thanks to all our healthcare partners and the leadership that supported these measures. If we look at the chain of transmission, it is absolutely critical that we understand and see that all of these layers of protection need to be in place for reducing the ongoing transmission in the community. Any lapse in any of these layers could result in transmission. So anytime if you hear an anti-vaxxer on anti-COVID people saying that these measures work, then why we still have the pandemic? But please remember that every layer of protection add more and more protection for you, and not a single measure will eliminate your risk. Even with the best of the intention, there are some lapses that happen all the time with people, and they may not necessarily follow all of these measures. So that's why every additional layers helps you to protect that. This is similar to wearing a seatbelt while you're driving. It is a safety layer. Doesn't mean that you will be 100% safe in case you have an accident, but it will for sure increase your survival chances, and that is why the evidence-based data shows that the death rate in motor vehicle accidents have decreased significantly since the introduction of the seatbelt laws. So similarly, we will anticipate that after a few years from now, we will have much more clarity in terms of data that what happened, what worked, and what didn't work. The oversimplistic explanation of all these anti-vaxxers or people who don't believe in COVID when they say, can you guarantee if we get the vaccine that we won't contract COVID? Or if I wear a mask, can you guarantee that I won't contract COVID, is completely illogical. And we shouldn't fall into the trap of intentionally trying to create doubts in my mind. So now, why are we seeing these cases more now? And as I briefly touched on it, we are talking about a highly transmissible strain of COVID-19 virus, which is the Delta strain, which is causing more and more cases everywhere. And right now, all of our cases are Delta strain that we are seeing. On the flip side, everything is open in Ontario, and leading more and more opportunity for people to come together, whether in a private setting, business setting, essential settings, or non-essential settings. And infected individuals can now potentially infect all of their household members. That's what we are seeing in Windsor-Essex, that one individual, when they get sick, they're infecting pretty much everyone else in their household if they're all unvaccinated or not eligible to receive the vaccine. These infected individuals are also going to their workplaces because a lot of them are working, and they are exposing people at the workplace. They are going to essential businesses and they're exposing people there. They are going to non-essential businesses and then they're exposing people. They're having social gatherings where they are coming in close contact with other people. So all of these exposures because of these infection is continuing on to a significant surge in the number of cases. So then why are we seeing cases in the vaccinated group? So I just put together this. It's not a fancy visual, but I tried my best to make it simplistic as much as possible. So you see that you have a red star that is representing an infected individual, and the red star come into an event or a business establishment and was surrounded by white stars who are representing unvaccinated or partially vaccinated susceptible individuals. Whereas the green stars represent individuals who are fully vaccinated. So let's play this scenario. Hypothetically, this red star or the infected individual will expose the white stars if public health measures were not followed, and also expose the green star. Given the highly transmissible strain, Delta, there's a strong possibility that the majority of white stars or unvaccinated will get infected, but the transmission may not, will get infected, but the transmission may not necessarily happen to the green stars, since the vaccine is highly effective and less than 20% of the vaccinated individuals will contract the disease. If the green stars or the vaccinated people do contract COVID, the likelihood of is even less for them to develop severe disease. But in this case, the exposure risk is through one infected individual, and likely the quantity of virus that will potentially enter any of these individuals will be slightly low, and then the antibodies response from the vaccinated people will practically contain the disease, and then the vaccinated individual will not develop the disease. But then let's change the scenario, and now what you're seeing is you have got more infected people or more unvaccinated people who are already sick coming into the same event with the less number of people who are unvaccinated and same number of people who are vaccinated. But in this situation, because of the likelihood of exposure, everyone will have a much bigger exposure risk, as well as the vaccinated individuals. They will have the slightly higher risk of coming in contact with a higher quantity of viruses that will enter their body, which could lead to a decreased response from their immune system just because of the sheer number of the virus that will enter their body and can potentially lead to infection. So just as a easy explanation, that you will see that the simple probability of having one case will probably lead to less risk to even the vaccinated people. But when you increase the number of cases among the unvaccinated, the likelihood of vaccinated people who will get sick will also increase. So again, just continuing to build on that, it's also about the number. So it's not necessarily just the percentage of how many individuals we are seeing. So let's say if we start off with 10 cases that are unvaccinated, you may have 10 unvaccinated case and 4 vaccinated case in the same scenario where they are in close contact. But if you just change that to 100 cases that are unvaccinated, you will have much higher number of people who will contract the disease, including a higher number of people who are vaccinated. So leading to a much bigger impact into our community, much bigger transmission, and also a higher burden on the healthcare system. So in Windsor-Essex, what we are seeing right now is a daily increase in the cases, and we can see that we are pretty much close to our case rates where we had our peak of our third wave, which is pretty significant now that we have all of these activities open, and despite a high vaccination rate, we are continuing to see large number of cases. Our current 7-day average is about 53.6 cases per day, and this is a huge increase from last week. And as discussed in the number of previous slide, just the sheer number of the likelihood of people who will get sick the likelihood of them going into the hospitals or likelihood of them developing more severe disease or people dying from it will increase. So even if we're talking about the complication of 2 to 3%, when you're increasing that number, that's a lot. And we need to be mindful of it's not just about one individual who is unvaccinated or one individual who's getting sick. Now we are talking about many active cases, which are coming close to 500 active cases in our community. This slide captures week-over-week incidence. So right now we are sitting at 87.5 cases per 100,000 population. And if you remember previous metrics, we are well above into the red control zone based on just this metrics. And last week at the same time, we were at 58.1 cases per 100,000 population. So pretty significant increase. And just in the last 7 days, our case rate is 69.4 cases. And this is, again, it's a huge increase from last week when it was 37.3 cases per 100,000 population, almost doubled from where we were last week. Looking at our wastewater surveillance data, it aligns well with the cases, and actually it's showing a higher signal that there will be more cases in the coming days, because this is an early sign, and overall throughout the pandemic, it aligned well with what we were seeing in the community. So we are definitely experiencing a fourth wave, and without taking any measures, without thinking it through, we will be putting everyone in the community at risk for further closures, further lockdowns, further disruption of economic and social activities, which none of us wants. So this figures look at the person positivity for the week ending on August 21. Our person positivity was 7.5%, which has increased again from last week when it was 6.5%. Looking at our age and sex distribution, well, overall in the last week, our cases are higher in 0 to 19 age group, 20 to 29, and also between 30 to 39 years of old. And in a nutshell, over 70% of our cases in the past 2 weeks were among those belonging to the age of less than 40 years. These are all the age groups where the vaccine coverage are one of the lowest, and especially in the case of 0 to 19, these are not eligible, majority of them are not eligible to receive the vaccine yet. So this is a new slide, and here we are looking at our variants of concerns, and we saw the Alpha variant in blue dominating locally in our mild third wave. Now, as we are entering the fourth wave, we are seeing that Delta has become the most dominant strain and accounts for the majority of our cases. And as you can see, the uptick or the number of cases that are resulting from Delta is much higher, and it's taller in the graph compared to our Alpha variant that we have seen in our third wave. We are starting to see an increase in the hospitalization locally in the blue line, as well as in the province with the green line. Similar picture, we are starting to see an uptick in the ICU beds in the province, as well as in Windsor-Essex. And our median R effective is now at 1.09. This is slightly lower from last week, where we were at 1.46, but we are still above 1. That means we have the cases will continue to increase in the coming weeks unless we bring the R effective to less than 1. That means there will be a reduction in the number of cases. So what are some of the recent key risk areas that we have found so far? So what we have noticed is weddings have been proven to be the major super spreader event this month, with 3 wedding clusters that resulted in over 50 cases, including several others from other PHUs who traveled to Windsor-Essex County for the event. And a high number of cases have also been linked to restaurants, although the number of cases per restaurant is small. And transmission within the restaurants have been limited to date. In contrast, a high number of cases had been linked to a small number of nightclubs, bars, and adult entertainment clubs, and evidence of community transmission within such locations have been observed. From an acquisition and transmission perspective, so we can see that the majority of the cases were linked to wedding, where the acquisition happened, and the nightclubs where the acquisition happened, the virus was acquired from the event or location, while the majority linked to restaurants acquired of the virus elsewhere, but visited the location while they were infectious. So for bars and adult entertainment clubs, an approximately equal number of acquisition and transmission exposures were observed just in the last month. So what are we doing to contain the spread? We don't want to disrupt the economy and like to support our businesses and communities to stay open and to continue to follow the public health measures. We want to put a renewed focus on the enforcement, and as important as it is, we don't want people to think that the pandemic is over and there are no restrictions in place. We have restrictions in place. There are capacity limits. There are requirements for business establishments to follow certain public health measures. These are all part of the Reopening Ontario Act that is still in effect, and people will be charged if they are not implementing or enforcing these measures. We are recommending vaccine policies for employees and patrons, as Nicole mentioned. We have implemented it here. We'll continue to recommend all our businesses to implement vaccine policies for their businesses, for their workplaces, to encourage people to get vaccinated to prevent any disruption in the community. We are also working with other public health units, levels of government to implement vaccine verification system that can be validated and can be used across jurisdiction instead of a patchwork of one health unit developing a system that cannot necessarily be followed or implemented in other areas. There is less chance of forging that document if we are thinking about some kind of a paper-based work. So we will work with all levels of the government. We will work with anyone to implement a vaccine verification system that can be used across the region. We will share additional details when we have them. So overall, in summary, the case rate has significantly increased this week. Our wastewater surveillance data is indicating a rise in COVID-19 in the region, and we will continue to experience more cases in our region. Our hospitalization and ICU has increased, and we are working actively on addressing the key areas that I have highlighted based on the exposure, acquisition, and transmission risk, instead of broad sweeping measures, to see what can be done and how we can implement and enforce that. We will work with everyone to implement vaccine verification system to assist our local businesses having the ability to continue to stay open while limiting the risk to their patrons and to their employees. Our most recent monitoring indicators is showing 87.5 cases per 100,000 population, which is significantly high. Our most recent 7-day rate is 86.8 cases per 100,000 population. Our percent positivity has increased. Our R effective has decreased slightly, but still it's above 1, indicating that there's ongoing transmission. The number of outbreaks every day is increasing in our region, which is a concern. And right now we have almost 80% of our Windsor-Essex adults who have received at least 1 dose, and 73.2% of Windsor-Essex adults that are fully vaccinated. Thank you.
We'll now take questions from the media. Today we'll start with Blackburn.
Good morning. You mentioned that you're going to be increasing enforcement and you don't want to put out more like blanket restrictions for businesses. So what can businesses and restaurants, nightclubs, etc. Expect with this increased enforcement?
Well, what we are hearing from our investigation is many of these businesses are not enforcing masking when it's required. Many of the businesses are not enforcing the physical distancing measure that is required. Many of the businesses are not enforcing the capacity limit that is required at this time. So we're meeting with all our enforcement partners to give out a clear message. And again, it's not punitive. Please. It's time. We need to follow. As much as I want everyone to stay open, we also cannot ignore what is currently legislated, what is currently the requirement under the ROA. So we want to work with them. Please don't get to us to the point where we have to issue charges. We want to work with you. We want to support you. If there's any confusion, we'll be happy to clarify any confusion. But this message has been clear. Nothing has changed. The ROA requirement is there. and we have to follow it. And that's not an excuse for people at this time, especially to say we don't know. The guidelines are very clear. There's very few gray areas that we can think of, but the rest is very clear. Like the capacity limit, it's clear. It's very clear. If you're going to a restaurant, you need to know that you have to wear the mask every time except for the time when you're eating. That's not an excuse that you're leaving your table just to walk around or to going to the bathroom without wearing a mask. If you're standing in line and if you're in an indoor space, you still have to wear the mask. You're waiting for a pickup, you have to wear the mask. Those are simple, basic things that people have to do. When we're talking about the nightclubs, physical distancing need to be maintained. If you're going to a nightclub, doesn't mean that all these physical distancing and other measures are gone. You have to maintain that. All of those things are in place to protect you and to protect others. So we will be putting out more of these messages, as well as work with all our law enforcement partners, including our Ministry of Labor, to initiate, again, some of these enforcement blitz to support our community and to ensure that our businesses are staying open. And then we also have to, because of the exposures are increasing in the community, we will be going back to looking into more exposure notification. We will be looking into businesses that are non-compliant or businesses that are not following these public health measures. There may be some guidance in terms of identifying those businesses to ensure that the public is aware of the risk where they're going. If there's any outbreak that's being declared, we already have the Section 22 order in place that any time if the cases exceeds 5, the business has the potential to be shut down. Those orders are already in place. So we want to make sure that even the businesses are aware of that. We don't want to use these type of measures to penalize anyone, but if it's necessary in the best interest of the public to protect the public health, we will take that measures and we will make sure that everyone in our community is safe and protected.
Sorry, did you say you've already had to shut down some businesses, or that's just one of the tools in your toolbox?
We already have those toolbox in place, Section 22 order in place, and we haven't gone that far to shut down those businesses because the businesses generally comply. But now sometimes we experience some businesses who don't take it seriously and who are not interested in doing that. So we may take that extraordinary measures of shutting them down as well, because those are already the measures that are currently in place under our Section 22. There are measures that we can apply from the Reopening Ontario Act as well.
And finally, on the vaccine front, now that more businesses, organizations are announcing that they're putting vaccine policies in place, particularly the universities and the college, have you noticed any uptick in people getting their first doses? Has there been a response to these vaccine policies being put in place?
So I didn't share some of the vaccine slide just because of the length of the presentation, but yes, we did see a slight uptick in the new vaccine request. That request is still somewhere around like 10% or 15% increase that we have seen. We like to see it more, and again with the open recommendation to all of these businesses and establishments to have vaccine policy, I'm sure that there will be more uptake. And also, as we are working with the vaccine verification system, working across with all our public health units, colleagues, partners, different levels of government, there may be more interest in getting the vaccine sooner than later. Once cases starts to spread, it's very difficult to contain. Please note that. You cannot just ignore that and defer the vaccination just because you feel that it's not you will get it later. There is no later. Once the virus starts to spread, it's very difficult to contain it. The best way to get ahead of it and get yourself vaccinated, make sure that you are protected and you are doing it for yourself, for your family, and also for your community.
Okay, thank you.
Any questions from the Windsor Star?
Yes, good morning, Doctor. Good morning, Nicole. Doctor, can you comment on why it might be that our region seems to be so heavily impacted by the fourth wave compared to the rest of the province. I've seen projections and charts showing provincial data for all regions, and we seem to be number one.
A great question, Taylor. And so a lot of that, when we are seeing what happens, how the virus spread, a lot of that has to do with how we behave publicly, because any type of infectious disease, it's highly dependent on our behavior too, what kind of behavior we are seeing. So when we are looking at our third wave, so there are something that benefited us in the third wave. We had a milder third wave. We had a high vaccination rates. We had people who basically just, rolled up their sleeves to get the vaccine. So we got a great response. And then as a result, we have seen less cases. What happened when with all the good thing that was in place, it gave public the impression that, our region is one of the safe region, which it was. But then people started to engage in high-risk behavior. People started to engage in activities that put them at risk. And also in the mix, you have people, which is significant, as I mentioned, close to 100,000 people in our region that are either not eligible to receive the vaccine or are unvaccinated. You have those people in the mix too. So even in gatherings and in the situation where you are bringing all these mix of people who are vaccinated versus unvaccinated, you will continue to see that this spread is happening. We reported that roughly around 80% of our cases that we are seeing is among either the unvaccinated or the people who are partially vaccinated. Those are the cases that we are seeing right now. So clearly this is the pandemic that we are seeing. We can call it the pandemic of the unvaccinated. And we have got a pretty significant number of unvaccinated people. And unfortunately, many of these unvaccinated people are also engaged in very high-risk activities. So that's why we are seeing that. Our region has always been one of the disproportionately affected region in the pandemic because of several reasons, as I identified. Our proximity to border, our population group, our demographic, our migrant farm workers. There are many reasons for us to have those high case rates. For people who are following these public health measures, they are not experiencing any of these things. But there are a significant group of people who are still unvaccinated and continue to spread. So those are our understanding of the issues in terms of what we are seeing. And as I reported in terms of the exposures and the acquisition and transmission, our investigations are basically showing that these establishments are not enforcing these public health measures. So you mix it all up, you have a deadly combination of ongoing spread and continue to see some of these challenges that we have experienced throughout this pandemic.
And you mentioned working with other public health units, levels of government to create this vaccine verification system. Do you have a timeline for when it might be complete? Any estimation for when the public might see those things enacted?
So there are some solutions that currently exist that are private solution, and I think what is helpful if there is a solution that is acceptable and valid across broader areas. So we can look into a local solution. We can tap into some of the private solutions that exist here and promote that locally to support our businesses. But the problem is you cannot have 4 different systems to access 4 different services. And then if you are visiting another region and if they want another type of verification system, how would you do that and how would you provide that system? How is this system connected with the central database to ensure that whatever you are showing, it's a validated proof of your vaccination? And how do you do that? How do you share that information with the people who need that? How are they storing that information? And then is there a need to show any type of a proof? Maybe just some kind of there are different apps that basically takes your information and then it just shows you with a green, red, or whatever, whether you're eligible to attend this establishment or not. That's the reality that we are facing right now. And so we are trying to have a more consistent approach across the province at least, and to see if a central solution comes down to us, that would definitely be very welcomed. But if that doesn't happen, there may be other opportunities to look into a solution that can be adopted by many rather than just one health unit coming down with their own system.
And whether it's a centralized approach or a localized one, do you think we would see that in 1 week, several weeks, a few months?
Well, I would expect that at least it'll be few weeks. I definitely don't want to say few months. I would like to see it as soon as possible. There are some health units who are leading this work, and we will continue to work with them and also to request the ministry to see if there's any kind of centralized approach that can be taken across the province instead of a patchwork where everyone is trying to come up with their own local solution. I would anticipate that it should happen in weeks and definitely not in months.
And finally, can you comment, I don't know if Nicole wants to comment on this as well, but what strain is the increase in cases putting on the public health system and the resources that you have? And are you again having to redeploy your staff from their regular duties to work on COVID-19 specific efforts?
Thanks for that question, Taylor. We are struggling. Our case counts here, that rapid climb puts a real strain on our internal services. We are redeploying, trying to redeploy temporarily while we secure sort of a larger team to meet both demands, which we have in the past over the year. We've kind of shifted resources between vaccine and cases. Now we have both demands at the same time, and it certainly it's difficult for us internally. We are struggling right now. We have provincial supports that have been provided to our health unit and are increasing right now, but it does take time to train, get people on board. So I guess one message I would say, and something we are trying to get out there, is if for those who have received a positive result, we need to follow up with you. Those individuals need to isolate and they need to wait for public health to call. And it may not be as quick as we would like, because we just we are struggling with the number of cases we have right now and the number of staff we have available to respond to all of those cases. So it is something we'll continue to talk to the province about. We're continuing to remobilize internally, but we do have, a number of competing priorities right now. And it's just truly all of our staff are responding to the pandemic, whether it's vaccination or COVID. And I will say as well, another concern for us is just some of our other critical services that we don't want to shut them down, like our dental services for seniors, for example. This has been a long road, and there's some critical services in public health that need to be maintained as well. And so we're just balancing all of those priorities right now and doing our best for sure. But it's been a struggle the past week or so for sure.
Thank you.
Any questions from AM 800?
Nicole, just in regards to what you said right off the bat in regards to the health unit implementing its own policy, can you tell us how many health unit employees are vaccinated right now? Do you have a percentage by any chance?
No, I was asked this question last week. We don't. We haven't collected per se that information. We'll be collecting it now as part of the policy. So I can't tell you exactly what percentage that we are at across all our staff, but it does apply to our staff, students, and volunteers. So, we'll be able to give a better idea, obviously, once we, this is a fresh policy, so I think once we gather that information, we'll have a better idea of where our percentage is at. I expect it's pretty high. We're all public health professionals here, and this, vaccination is certainly a big part of what we do, so I expect it's really high, but I couldn't give you an exact number.
I know many of your staff members are unionized. Did you have to work with the unions on this policy, or is this basically right from the health unit in your team?
So it is certainly a policy led through our senior leadership team. We, did speak with our unions, to discuss it briefly and let them know. Again, I think I said in my comments, this decision was an easy one. We're public health. This is sort of what we do. So, but yes, we did discuss with our unions to let them know that this was something we were looking to implement.
And just a couple quick questions for Dr. Ahmed. Dr. Ahmed, obviously with the cases increasing and school hasn't even started yet, is this one of the most times since the pandemic you've been concerned? I know you've always concerned, but you're concerned at its highest level right now since the beginning of the pandemic?
Yeah, Rob, as I was trying to transition myself away from the challenges here, we are seeing the unprecedented number of cases. I think this was not expected, truly. And I am worried that just because everything is wide open, and if we don't put a plug on this, it will continue to spread. And then you have, the data is basically showing that how quickly Delta spreads everywhere. And it takes few cases to spread it in vulnerable population. And when I'm saying that the school, it could be a potential risk, because most of the children are unvaccinated who are under the age of 12. So anyone who's under the like grade 6 and younger, they're all not eligible to receive the vaccine at this time. And if it starts to spread, it will spread very quickly. So I think it is important that, as we talked about, that in order to protect our schools, we need to have a low case rates in our community. So this is what we're trying to do, is contain it in the community so that it doesn't translate into the school system. And the toolkit that we have given to the school boards, we will be looking at it. We will try our best to provide recommendation based on the situation that we are seeing right now. And we would need everyone's support, parents, teachers, staff at the school board, to make sure that we are keeping our school system safe and keep it open for education. Our students, our children have suffered quite a lot by missing out on school. We want to support them, and it's just a matter of doing the right thing. Get your vaccine, please. We need that high vaccination rate. We need people to continue to follow the public health measures. We will continue to experience waves after waves otherwise, because we are still in a global pandemic. We don't live in isolation. We cannot just say that this is something that we can do, and then when it's done, we will continue to see new introduction of cases in our community from everywhere, from out of jurisdiction, from out of country, from everywhere. We will see that, and we need to, as we continue to see, we need to adapt to something that's important right now. Getting yourself vaccinated, fully vaccinated, and continuing to ensure that we are taking precautions when we have to. We don't have to take it everywhere, but especially in public places, we have to. So those are some of the things that will help us. And unless we do that, we will continue to be in that situation, and it'll be a huge challenge for everyone. And now is the time. And I've been saying this for more than a month. It is time. It is time. We need to take action, and that's why we are taking it a step further by asking very clearly what the expectation is, asking about enforcement, and maybe also looking at implementing some of these specific measures targeting the high-risk areas, and do our best to keep our community safe and keep the economy going.
In your presentation, you talked about weddings and the clusters. I believe you said 3 weddings right now. I know you and Nicole have mentioned about the vaccination policies. Are you hoping these venues, these halls, start asking, I guess, to be vaccinated? Would that help out?
Yeah, I'll see if Nicole has any additional comments, but basically, yeah, the expectation is every businesses, every workplaces, they should offer that. They should have the vaccination policy, not only for their own staff, but also for the patrons as well. Let's just be clear. We're talking about non-essential businesses. We're talking about non-essential businesses, not the essential business. For example, if we have dental clients coming into our clinic, we won't deny them service. That's the healthcare service that we will need. We will have a specific protections in place to protect our employees as well as to protect the individual who is visiting that. But we are talking about non-essential businesses, non-essential workplaces, which does have, and all of these workplaces does have a discretion on who they allow and who they can expect in their establishment. It is well within their rights, and having a policy will protect their staff. Having a policy will protect the community and prevent any of these transmission. So yes, I am expecting that all of these venues, all of these establishments, especially the non-essential establishments, will have some kind of a policy in place to ensure that the transmission is not happening in those places.
Thank you.
Any questions from CTV?
Yes, good morning. I was just wondering, what is the health unit's plans for third doses for high-risk individuals, and why is that necessary?
I'll start and then I'll turn it over to Dr. Ahmed. So I'll talk about our plan and I'll turn over the why to Dr. Ahmed. So, have been asked about this. We are working with our hospital partners, healthcare partners, around those that are eligible. It is a really specific group of vulnerable clients that are eligible for third doses, including long-term care. We will be starting, and again, in partnership with long-term care and high risk, some of those high-risk settings that are identified. We will be, we've already started to contact individuals who are eligible and have a process for that as well. We will be starting in long-term care, I believe, starting that process next week. So, it is happening right now. Again, it is a smaller group, so we'll be contacting directly as well, working with individuals in the community who maybe aren't contacted yet or waiting. They can also work through their physician, to then book them for a third dose. So we're just preparing the most appropriate, avenue for them to receive that dose, as well as the best process to reach everyone who's eligible. And I'll turn over the why third doses for this group to Dr. Ahmed to answer.
Yeah, so obviously the scientific community is monitoring the data of vaccine effectiveness, looking at any challenges, any concerns about who this vaccine is helping and who it's not helping. So based on all of that data, the evidence clearly points out to the fact that individuals who are immunocompromised, they need a booster dose. Their antibody response slows down or goes down after at least 6 months timeline. So a 6 to 8 months timeline, it starts to go down. That's where the booster effect comes in. For the rest of the general population, there's not enough data at this time to suggest that we need that. Some countries have implemented it, such as Israel. They're already going for a third dose booster. But at this time, not necessarily having the scientific data to back it up to say that, yes, we need that. In the future, maybe we'll have more data that validates that. But as of today, we have good evidence to recommend a third dose booster for the immunocompromised people, seniors in the long-term care home. So that's what we are doing right now.
Thank you.
Any questions from CBC?
Yes, good morning. I have two questions for Nicole to start. You mentioned that businesses can request a mobile clinic. Is this a brand new initiative? Have any of these clinics been held at workplaces so far? And the other question is, I also wanted to ask about the response to the vaccine bus initiative.
Yeah, thanks for both those questions. And they're both new initiatives. So I think you've heard us beg, plead every week around vaccination and talk about the different sort of strategies and avenues to get vaccines out to our community, offering for workplaces to be able to request vaccination for their workplace is something that we're happy to introduce, and obviously we'll accommodate it based on a schedule and the staff that we have available. We have provided vaccination for a couple of workplaces just as a trial. As you know, we're also out doing vaccines with our partners at Erie Shores, EMS, and sort of the high priority community group. in various neighborhoods as well. So the workplace thing is new. And certainly as workplaces, as we've identified, are considering their own vaccination policy and maybe are looking at how many of their workforce are vaccinated or unvaccinated, this may be a really great way for them to bring, and make it convenient and easy for their workforce. So that is something that's fairly new. We haven't, again, really openly launched it. We've kind of quietly been piloting behind the scenes. So we haven't, we've just had a few so far that we've been able to accomplish. The vaccine bus also was, again, it's a pilot. I think so far it's going really, really well. I love the idea of destination vaccination. The City of Windsor, can't thank them enough, and Transit Windsor for their jumping in with us. We really just gave them a call and said, we'd like a bus. Can you work with us? And they've really moved mountains to make it happen and make it happen quickly. And again, it's just another strategy to make it easier for us. The setup, having staff go out to a mobile site, set up, take down. We're hoping the bus just makes it easier for us to get out into various communities, move around to where folks are, and make it easier for our staff so we can cover more ground. Today we'll be, I believe we'll be in, this morning we're in Windsor, and then this afternoon we'll be at the Bell River Marina. So just can't thank all of our partners for, giving us space to park, and certainly Transit Windsor for that. So we'll be tracking and monitoring how successful it is, and then our hope is to be able to work, and if it is successful, we'll maintain it for a longer period of time.
So far you don't have a ballpark of how many people have been vaccinated on the bus?
I could get that number for you. We've only been to a few events. Some were quite, went really well, and others not so much. But I can get you we can give an update about maybe next week, given the events that we've had with the bus and how successful they've been. We are working a little bit on just making sure it's clear that it is the vaccination bus. I think in the first event, there wasn't a lot of signage, so it maybe just looked like a bus sitting. And so we're trying to work to make sure that it's really clear that it is the vaccination bus. And we're trying to work through social media to get that message out so that people are aware. So certainly for media, helping us out and tagging our social media and residents sharing that information will help make it more of a success for sure. But we'll give you numbers. I think probably next week would be a better time to give you numbers about how successful it's been so far. I will also add, we are looking at other opportunities, for more events, et cetera, to bring mobile options there. So you'll hear more about that in the future as well.
Thank you very much. I also have one question for Dr. Ahmed. You mentioned that you don't want broad sweeping measures like we've seen earlier in the pandemic. I'm wondering what happens, though, if you don't see the results from this uptick enforcement that you'd like to see in terms of case count?
Well, I think as the medical officer of health, we do have that responsibility to protect our community, and if needed, those broad measures will come in. We are trying to take a graduated approach in terms of doing what we need to do with minimal disruption. But if that happens, obviously we'll have to have some discussions with the province too to get them on board, to get their guidance and what they expect us to do. And if it has to be a local decision, then I'm sure that the medical officer of health will make those local decisions in the best interest of the community, in the best interest of the public, because what we are dealing with right now is the pandemic of the unvaccinated, which is roughly 20% of our people in the community, while 80% of our community are in support of getting the vaccine, keeping everything open, doing their part to keep everything open. So I think it's unfair for them, for those 80% of the community, to get impacted or to be held back because of the 20% who are choosing not to get the vaccine. So I think that's the difference, and we don't want to see that kind of extreme measures, but I think that the politicians, everyone, they are already supportive of some of these measures to encourage people to get the vaccine. There are a number of key initiatives that is happening to increase the vaccination rate in our community. But if all that fails, we continue to see some of those challenges, then we will be left with no option other than that. So I think it's important that not only we get our vaccine, but also we should support and encourage everyone else to get the vaccine to contain the disease, to prevent the spread of transmission.
Thank you very much.
Any questions from CFTV?
Hi, yes, good morning. I'm going to ask a different sort of question here. We've got, with school opening, we've got children that are eligible to get a vaccine, the 12, 13, 14-year-olds. There are parents in the community that don't want to have their kids vaccinated. They are totally against it. And the children in these homes want to be vaccinated, but they have no way of getting to these clinics alone without a ride from their parents. Are these kids going to be offered a vaccine at school? Because we know that they can, say that they can have a vaccine, they can authorize their own vaccine. Will they be allowed to do that at the schools when school opens so they get a chance to get a vac?
So right now, it's recommended that children, talk to their parents talk to their children about vaccination. But right now, youth, can consent for themselves and they can go to a vaccination site. As you said, transportation may be a concern. There are several initiatives, including for certain some of our FSAs where there is free taxi rides, so that might be an option. We are working with our school boards to provide COVID vaccine opportunities at the school. So we're actually working right now, we're at all going to all the grade 9 orientations. We have a team there, again, talking about immunization and then offering vaccination through the high school grade 9 orientation. We will be looking through the month of September as school starts to be in the schools and to offer those opportunities at the school, answer questions for youth and for parents around COVID-19 vaccination. So yeah, in short, to answer your question, there will be opportunities outside of just our mass vaccination clinics for youth to do so.
So there will be maybe opportunities for the kids that are 12 years old at the elementary level as well?
Yeah, for anyone who is eligible. We'll work with both our school boards to offer that. And I know, the ministry has put out guidance around ensuring that those opportunities are available.
Wonderful. The other question I had for you is you were saying that, I was hearing this morning about essential businesses not being asked, if I heard this correct, they're not going to be asking people that come in to provide proof of vaccine, but that regular businesses, you would like to see all of the businesses, asking for proof of vaccination before they come into non-essential workplaces. If you have a workplace that has been deemed as essential and you don't feel that it's essential business because it really isn't, is there any legal ramification to asking people to provide a vaccination record before they come in to see you at your establishment?
So I'll take this question. So first of all, we are recommending the vaccination policies for every businesses, more so for the non-essential businesses. What we are saying is, especially in the essential businesses that provides critical care services such as healthcare, there are some obligations as a healthcare provider for us to provide them with the service regardless of their vaccination status. So I think that's the clarification that this is not the case. As far as when you're talking about essential businesses, I think there has been some concerns raised, but many of those concerns have been addressed by having some alternate way for these people to access those essential businesses. Sometimes it's by giving them what they need without letting them inside the establishment. There are other ways that they can offer. They can pick up their business. They can have some of these services delivered to their home. There are options. So there is nothing for people who genuinely need that. They are provided that option, but we're not talking about those individuals. So let's just be clear. We're talking about people who choose not to get the vaccine. So, and when we're talking about those individuals, I think those that's why we have to have that clarity. that as long as you have those options, as far as legal ramification, obviously I'm not a lawyer, but what I have read and what I have seen so far based on various case studies and what has been a challenge and what's not challenged, people can say whatever they want. People can challenge anything and everything. So you cannot stop them from doing that. But how many of that would stick? Throughout the pandemic, I think there has been some consistency in the legal justice system that the courts have always sided in with the majority of the doing good things. And as long as there is I guess there are options available for some of these people, that's what they need. It doesn't have to be that especially when we're talking about non-essential business or for private businesses, they have the right to allow who enters their establishment and who cannot enter their establishment.
Wonderful. Thank you so much, Dr. Ahmed. No further questions.
Thank you. We're going to end the conference now. Have a great weekend, everyone.
Thank you.